Hey everyone, welcome back to the Medical Madam. I am Dr. Lindsey Harding. I'm a licensed naturopathic physician in Washington State, and today we are talking about increased intestinal permeability, aka leaky gut. So leaky gut is all about the small intestinal lumen. So it's the innermost column of cells in your small intestine which are responsible for absorbing all of your nutrients. So along with absorbing all of your nutrients, the other main role these cells play is protecting you from all the potential pathogens that you are being exposed to when you eat. So two main functions: help you absorb your nutrients and protect you, okay? So this all happens in the epithelial cells in the small intestine. You have two main cells in this system. You have the villi, which have microvilli on the end of them, super fun. So these are little cells that stack on top of each other. And the microvilli are little finger-like projections that are right on the end of them. When you eat your food and you digest your food, the nutrients from your food, things like vitamins, amino acids, are taken up by transport proteins, and they're brought through these cells. And then from within the cells, they get deposited into blood vessels where they can go out to be assimilated into whatever system is going to use them. So we have our microvilli, our villi, and our tight junctions. Those are the main components here. So in this video, we're gonna go over the small intestinal lumen, more specifics about how it works so that we also understand where dysfunction comes from. We're gonna look at what causes that damage in the first place, what symptoms are if you're experiencing this, as well as how to get the inflammation under control and heal that lumen back up so that you no longer have leaky gut.
All right, so when we are looking at increased intestinal permeability, we are specifically looking at the small intestinal lumen. That consists of the epithelial lining, this beautiful row of orange cells that we see here. These are the villi, the microvilli, and the tight junctions. The purpose of the tight junctions, which you can't see here because they're holding the cells very close together, create a physical barrier preventing pathogens and food particles from entering the lamina propria, which is the layer down below the epithelial lining. Then we have these awesome cells called goblet cells, and they are creating mucus. This is what gives us our mucosal lining. And the main antibody present in mucosal secretions is secretory IgA. Secretory IgA stops pathogens from actually binding and penetrating into the intestinal barrier. So think of it as the first line of defense for the epithelial lining. Then we have the lamina propria, which is blocked by my picture here, but it is this area down below that contains more immune cells, and it has two main purposes. One is to provide physical support to the epithelial lining, so it actually helps maintain the structure. And obviously, it provides more immune defenses. So looking more closely at that tight junction, the area between the cells that's holding them really close together, we have multiple types of proteins that make up a tight junction. So we have barrier proteins and scaffolding proteins. So barrier proteins are what hold the cells super tight together, and the scaffolding proteins help maintain the structure. And then these are all linked to actin and microtubules, but all you really need to remember from this picture is that a tight junction is made up of proteins and adhesion molecules that hold the cells tightly together. Healthy tight junctions allow water and ions to pass through, and pretty much nothing else. So what happens when those tight junctions are damaged? Now we end up with space between the cells. So when we're exposed to bacteria and food particles, just normal from our digestion, those agents now have direct access into the layer below of cells, so into the lamina propria. So they can slip through those epithelial cells into the lamina propria, and the lamina propria is loaded with immune cells. So what happens is we activate an immune response because all of the cells in that lining see these potential pathogens entering, and they freak out because they say, you are not supposed to be here. So it is a protective mechanism by your body. So specifically what happens is the antigen presenting cells, specifically the dendritic cells, when they are exposed to these intracellular pathogens, so things that have gone into this level of cells but shouldn't be there, they're going to activate the production of different interleukins. Interleukins are created from cytokines, and so they are cytokines, but these are the different agents that create inflammation in our body. So interleukin 12 will activate T helper 1 cells, which will activate interferon gamma. Interferon gamma is very pro-inflammatory. So we're creating an inflammation cascade. On the other side, we are activating interleukin 6, which is going to activate T helper 2 cells, which create more cytokines, some of which are actually anti-inflammatory, others are pro-inflammatory, but it also creates B cells, and B cells create the protein called antibodies. Antibodies are trained to attack things that shouldn't be there. However, if you have an autoimmune disease, you know very well that antibodies can attack normal, healthy tissue when they are not supposed to. I mean, we're never supposed to attack normal, healthy tissue, but our bodies do sometimes. So these B cells can start to attack food particles that are normal. I mean, they can attack broccoli and lettuce and spinach, healthy foods, and you could end up having a negative reaction to it because your body is attacking it as if it's a bacterial infection because it's in the wrong place. If you create B cells or if you create antibodies to the wrong things, your body can end up creating an autoimmune disease. So if these antibodies start to attack your own healthy tissue, you will end up with an autoimmune disease. And this can happen if you have increased intestinal permeability and this system is going on unchecked. So what damages the tight junctions to begin with? Why is this happening? Really common culprit would be infections. Dysbiosis, so that is an imbalance in your microbiome. So we're talking about the normal, natural, healthy bacteria that live in our gut. If there's an imbalance in how many we have, maybe we don't have a lot of good bacteria, maybe we were on a lot of antibiotics at some point in our life, that can be really destructive and we can end up with dysbiosis. SIBO, which is small intestinal bowel overgrowth. And this is when the bacteria that are supposed to be in our large intestine translocate into our small intestine, and that can cause lots of issues. Chronic candida. Candida is a type of yeast. Stress can cause everything. Heat stroke. High amounts of heat can damage the intestinal barrier, specifically the tight junctions. If you already have an immunocompromised system, you're at risk because your immune system is already not going to respond quite as well as it should. If you have an autoimmune disease, again, same thing. Your body is already attacking things that it should not be attacking. So really common autoimmune diseases, specifically for the gastrointestinal tract, would be celiac, Crohn's, ulcerative colitis, microscopic colitis. These are all going to put someone more at risk and is going to make it more likely that you have tight junctions that are not functioning properly. Diabetes, really common culprit. A poor diet, honestly, that's probably why most people develop some level of leaky gut. And then excessive alcohol intake can also be really damaging. I want to mention, I posted 2 different articles here that I did read through when making this PowerPoint, and I really enjoyed them. They are pretty recent, from 2020 and 2017. They're really great information if you want to learn more about secretory IgA and more about the cell junction.
So what are some common symptoms of leaky gut? The tough part with diagnosing leaky gut is that symptoms are really variable, but the most common symptoms really reported are going to be chronic diarrhea, chronic constipation, chronic bloating, headaches, fatigue, joint pain, skin rashes, eczema, things like that. All your general signs of inflammation, because that's really what's going on, right? Your body is creating inflammation to help protect itself from what it believes are things that should not be there. And that's because the system to protect itself is broken.
Testing for leaky gut or increased intestinal permeability can be pretty tricky because it's more of a diagnosis when there are multiple factors at play. That being said, it's even a diagnosis that's not necessarily recognized by the medical community as a whole, despite how popular of a topic it has been over the last few years. But here are some really great testing options to see, do you have some of the markers that are associated with leaky gut, or are you at risk? Okay. So first of all, food sensitivities. Food sensitivities are different from food allergies. A food sensitivity can cause a much wider range of symptoms, and food sensitivities change. So even though you might have a sensitivity to, say, chickpeas right now, in a year you might be fine with chickpeas and you might have a sensitivity to soy. Sensitivities change, and it's really based on what is our body misidentifying and thinking that it's something harmful. So those antibodies are involved in this process. That being said, if you take a food sensitivity test and you have a whole lot of IgG allergies come back, that is a sign that all of those food particles from all those different foods on that test are getting through those tight junctions, and then your body is having a reaction. That is a sign of leaky gut. So if you have a lot of food sensitivities, that's a sign that something is not working properly and your immune system is overreacting to a lot of foods. Testing your microbiome. Great option. I love testing the microbiome. So we're really looking at what are the different bacteria ratios like that you have present in your GI tract. So I love doing this if someone has been on antibiotics for quite a few rounds. Even if it was as a kid and you're an adult now, it can make a really profound difference in your GI health. If you've been on proton pump inhibitors, these are all things that are going to damage your own healthy microbiome. If you've had infections in the past, you probably also have a damaged microbiome. Diminished in the quantity as well as the quality. So not only how many bacteria you have, but how many species of bacteria you have. Short chain fatty acids, these are byproducts of the metabolism of your microbiome. So if you don't have a healthy microbiome, you probably don't have healthy levels of short chain fatty acids. If you have low levels of short chain fatty acids, you are likely experiencing more gas and more bloating. So if you have some of those symptoms present, it's really awesome to have your short chain fatty acids tested. So then, of course, we have infectious pathogens. It is never a bad idea to make sure you don't have an infection. Inflammation markers. So secretory IgA, we talked about it before. So if you think about it, if you have an inflamed GI tract, if you have leaky gut or even another autoimmune or like irritable bowel syndrome or disease even, you're going to have high levels of secretory IgA because your body is trying to protect the mucosa. So it's really trying to protect those epithelial cells. So those goblet cells are pumping out more mucus and you're making more IgA to try to protect yourself. So high levels are associated with leaky gut. Similarly, eosinophil protein X is really high if you have a lot of IgE allergies. So these are your more severe allergies. Maybe you've had a skin prick test in the past and certain things have come back positive. Those are likely IgE allergies. These can also be tested in the blood. But if you have a lot of IgE allergies, you might have higher levels of eosinophil protein X. EPX is also high if you have atopic dermatitis, so things like eczema. So if you have a lot of skin issues going on and you suspect leaky gut, you want to check EPX. Lastly, enzymes are a great thing to check because it's super easy to replace them if they're low. But if you aren't actually breaking down your food properly, you're probably going to have higher levels of inflammation, simply because you're not getting in the nutrients you need to help keep a nice, even, healthy, balanced system. Treating leaky gut. I'm a naturopathic doctor, so I follow the therapeutic order. This is how most people are going to address it. The first thing we really look at doing is what are the most prominent symptoms for you, and we want to make sure those are being addressed so that you are not living in misery. Okay, so sometimes this does involve us using agents that are not meant to be lifelong. They're just meant to help you right now with where you're at. Sometimes it involves pharmaceuticals, sometimes it involves natural things. It really is going to depend on you specifically. So the most important thing to do first is going to be remove obstacles. So in this category is going to be things like treat the infection. Did you have an infection? That's an obstacle to cure. We need to get rid of that. If you are constantly eating something that you are allergic to or that you're having a reaction to, we need to remove that from your diet, because if we don't, we're not going to be able to get rid of the inflammation. We need to stop the inflammation from happening. So this is where we use a lot of good supplements that help to reduce inflammation on multiple levels. So essentially we're trying to stop the action of all of those cytokines. In stopping the inflammation, we need to diversify our diet and manage stress and sleep. Even though these are really foundations of health, which you'll see here on the little triangle, that they're all the way at the bottom, which means they're kind of like the last thing we address. When it comes to healing, if you're not sleeping, you're not healing. And if you have high stress, you're not healing either, because you're constantly going to have higher levels of inflammation. So we need to address those. Diversifying your diet, specifically in leaky gut, is really important because your body is attacking what it sees most frequently. So if you're eating the same food every day or even twice a day, like you're meal prepping, then you eat that meal every day for a few days, you're actually encouraging your body to develop antibodies against those foods that you're commonly eating. So you're going to end up with more of a problem and more food sensitivities for right now. Doesn't mean that they can't be healed up in the future, but you're possibly making the problem worse for yourself. So eating a more diverse diet and avoid eating the same foods day after day is really helpful in controlling the inflammation. So we need to repair the GI mucosal damage. So this is repairing those tight junctions. We need to bring those cells back together so we stop the passage of things from going from the intestine into the lamina propria. Then we need to replace any missing enzymes. So if you weren't digesting your food properly, if you are lacking in certain enzymes, we need to replace those so that you can actually break down your food and digest it better, and then also absorb it better. And very last, we inoculate the gut. So if you had some dysbiosis, if your microbiome is off, the first thing we want to do is not necessarily to throw a probiotic at you. A lot of times we reserve that for the last thing, because throwing a probiotic at you isn't going to solve the other problems. It might help diversify, but it's not actually repairing the GI damage. It's not actually stopping the inflammation. It can be helpful for all of those, but it could also potentially be more damaging in a lot of cases. So if you're someone who's taking a probiotic right now because you have a lot of GI issues, and say you notice that probiotic, you have more diarrhea with it, it's not the right probiotic for you. And honestly, there might be some other things that you need to be doing before you get back on a probiotic. When you purchase a probiotic, I always recommend doing something that has more species in it. And different species have different purposes, so it's really great to talk to your doctor about what species are going to be most helpful for you. And that is leaky gut.
Thank you so much for joining me today, learning about leaky gut on the Medical Madam. Since you're already here, hit that subscribe button so you can continue to get access to awesome medical information, learn more about your body and prevention. And I will see you all next time. Have a wonderful day.